Hi friends, I am Dr. Rajesh Ghanshani. I am physician and diabetologist practicing at Veraval, Gujarat. Well, today I want to discuss something about current scenario of diabetes in India. You all know that India has second highest number of diabetes patients all over the world, but there are so many patients who are still undiagnosed, those who are having borderline diabetes or frank diabetes, but still they are undiagnosed cases. So if you see the current scenario, India might have the highest number of cases worldwide in coming 5 to 10 years. So the important goal, our goal today is to diagnose those cases which have symptoms or those who are asymptomatic, those who are in pre-diabetic range. So we should create awareness regarding early diagnosis. We should educate patients to go and have a sugar checkup, especially those people who have a very high risk of developing diabetes, like those who have family history of diabetes, those who have obesity, those who are overweight or obese, those who are morbidly obese, those who have some other risk factors of developing diabetes, like those on some chronic steroid drugs, or those who have some endocrine problems. So in those patients, we advise to have self-monitoring blood glucose, or at least they should get done sugar test once in a 6 months to once in a year. So the problem in India is that we people usually have high incidence of diabetes at early age and with lower BMI value. So if you compare our data to the West, those patients in West have diabetes with higher BMI, but in India, even thin, lean patients who have low BMI, they also develop diabetes at early age. So we should have our own policy to diagnose diabetes, to start early treatment in diabetes. Also, the drugs which are being used all over the world, the guidelines differ in India and all over the world. The difference is that in India, most of the patients, when they are diagnosed, they are either diagnosed late or they are diagnosed with many complications. So we have to start early insulin, or we have to choose a drug which will bring down their HbA1c to 7 as early as possible. So our target should be to early diagnose diabetes, to start treatment as per patient's illness as well as other comorbid conditions and his weight. Also, we should emphasize early insulin therapy, because we have seen in our practice that most of the patients who have uncontrolled diabetes for 5, 6, 7 years, and they are still taking 2 or 3 pills every day, but still their HbA1c is never under 7. So our target should be to bring HbA1c under 7 to prevent long-term complications, both micro and macrovascular complications. And we should educate people not to worry about the insulin treatment, or not to have fear about insulin treatment. Insulin is a wonderful drug which should be started early when required. And also in peripheries where we practice, actually, we see so many patients who are unaware about the symptoms of diabetes. So we educate them, we do a lot of camps. So if anybody has family history of diabetes with weight loss, polyuria, polydipsia, polyphagia, some fungal skin infections which are not being treated with routine antifungal drugs, or they are obese, they are having some cardiac issues, or they are having some metabolic syndrome like problems, they should be evaluated thoroughly for diabetes. Also, to prevent long-term complications, we should always encourage them to have a routine kidney function test and eye checkups done. At least once in 6 months, they should go to the physician and thoroughly get done all these investigations. So the take-home message is, please don't ignore diabetes. At least meet your physician and get a thorough checkup for diabetes. Should do not only diabetes doesn't mean that only we should control sugar. We have to prevent other complications like retinopathy, which means diabetes affecting your eyes, kidney problems, which is called diabetic nephropathy, your nerves are affected, which is called diabetic neuropathy, and cardiac and neurological complications. So these all complications need to be diagnosed early, should be treated accordingly. So we all should come together and treat diabetes. Thank you.